Hello everyone, welcome to our channel. In this video we will discuss and solve some multiple choice questions related to hip joint which helps you in quick revision of hip joint. So let's start our first question. The hip joint is what type of synovial joint? A. Ball and socket joint, B. Ellipsoid joint, C. Saddle joint and D. hinge joint. Our answer is the hip joint is ball and socket joint. Our next question is the strongest ligament of the hip joint is pubofemoral ligament, ischiofemoral ligament, iliofemoral ligament and ligamentum teres, which is the strongest ligament of hip joint. And answer is iliofemoral ligament. Next question is the close back position of hip joint is flexion, adduction and external rotation, extension, adduction and internal rotation, flexion, adduction and external rotation, extension, abduction and internal rotation. And the answer is extension, abduction and internal rotation of the hip joint. Next question is the angle of inclination of the femur in adult is normally 90 degree, 100 degree, 125 degree and 150 degree. Angle of inclination, and the answer is 125 degree. Next question is coxa vara is defined when the angle of inclination is less than 120 degree, more than 135 degree, less than 90 degree and more than 150 degree. And our right answer is less than 120 degree. Our next question is the angle formed between femoral neck axis and the condylar plane is called Q angle, anteversion angle, angle of inclination and torsion angle. And our right answer is anteversion angle. Normal anteversion angle in adult is 5 to 10 degree, 15 to 20 degree, 25 to 30 degree and 45 degree. Answer is 15 to 20 degree. Increased femoral anteversion typically causes out-toeing gait, in-toeing gait, waddling gait and circumduction gait. And our answer is in-toeing gait. Next question is the main muscle stabilizing the pelvis during single leg stance is gluteus maximus, gluteus medius, adductor longus and iliopsoas. And our answer is gluteus medius. Next question is Trendelenburg sign is due to weakness of hip extensors, hip abductors, hip flexors and hip adductors. The answer is hip abductors, mainly gluteus medius. The Thomas test is used to assess hip abductor weakness, hip flexion contracture, IT band tightness and labral tear. Answer is hip flexion contracture. The Obus test is used to detect rectus femoris tightness, IT band tightness, psoas tightness and hamstring tightness. And the answer is IT band tightness, iliotibial band tightness. The primary blood supply of the femoral head in adult is obturator artery, lateral circumflex artery, medial circumflex artery and inferior gluteal artery. Answer is medial circumflex artery. Next question is the acetabulum labrum is composed of hyaline cartilage, fibrocartilage, elastic cartilage and dense ligamentous tissue. And the right answer is fibrocartilage. Next question is the capsular pattern of restriction in the hip joint is flexion, abduction, internal rotation, extension and abduction, flexion, abduction and internal rotation, external rotation, abduction and extension. And right answer is flexion, abduction and internal rotation. If you want topic wise question and answer, please comment down. Thank you.